I'm going to get us started because people are going to start. Out of respect for everybody's time for showing up, I really want to get us started here, and I want to thank all of you for being here. Rutgers School of Public Health, there's so many of you present. Thank you for that. And I want to also take a moment to thank my colleague, Laura Magaña, for joining us today. I'm Perry Halkitis. I'm the Dean of the School of Public Health. I'm also very happy to be a member of the Association of Schools and Programs of Public Health, which I first learned about while I was at another institution, and I had the opportunity to get engaged with many of the sections there. And since that time, I've been very actively involved with the organization that does really, really, really incredible work in advocating for public health education throughout the country and throughout the world. And I'm honored to be the chair-elect of the Association of Schools and Programs of Public Health, which I will be becoming the chair of next year. And our colleague at CUNY, Ayman Mohandas, is currently the chair. So I'm in great company with all of my colleagues at ASPPH. So I'm honored that Laura's joined us today. Let me do the official introduction of Laura so that you are all aware of her amazingness. Dr. Laura Magaña is the president and CEO of the Association of Schools and Programs of Public Health. Under Dr. Magaña's leadership, ASPPH has continued to advance its mission to strengthen the capacity of members by advancing leadership, excellence, and collaboration for academic public health. During her tenure, ASPPH has strengthened academic public health research through the Data Center, launched the Academic Public Health Leadership Institute, and enhanced the voice of academic public health through advocacy efforts. She expanded her global reach by welcoming international members, led ASPPH to join with other regional associations that represent schools and programs of public health around the world, to found the Global Network for Academic Public Health, which enhances academic public health worldwide through mutual learning and collaboration between academic public health institutions globally. Dr. Magaña has launched 3 strategic initiatives to address critical issues in public health as part of ASPPH's Vision 2030, and we're going to be hearing about one of them today: Dismantling Racism in Academic Public Health, Climate Change and Health Task Force, and Framing the Future 2030. Prior to joining ASPPH, Dr. Magaña dedicated more than 35 years to successfully leading the transformation and advancements of public and private institutions in universities in Mexico, educational organizations in the United States, United Nations programs, and non-governmental organizations in Central America and Europe. She was most recently the Dean of the School of Public Health in Mexico at the ASPPH member National Institute of Public Health. She has also been a faculty member and lecturer at universities around the world. Dr. Magaña's portfolio registers 90 academic publications in educational and technological developments, many of which relate to learning environments, the use of technology in education, and public health education. She frequently speaks with universities, partners in national and international conferences on issues such as social determinants of health and health equity, the future of education for public health and the public health workforce, and critical issues in global public health. I cannot think of a finer, more intelligent, kinder collaborator than Laura Magaña. Every minute of working with her is a dream for me. And as many of you know, my Rutgers Public Health family, I don't like most people, but Dr. Magaña is one of these exceptional human beings who I have the great honor of working with. So it is with great pleasure that I introduce you to Dr. Laura Magaña.
Perry, thank you so much. That's the really very kind introduction. Let me just share my screen here so I can start. All right, can you see one more thing here? Wait. Let me see if I can. I'm sorry, let me just, because I can't move my screen. I'm sorry, I can't move my screen. Let me try it again.
Let us know if we need to help you.
Maybe this one. Let me see this one. 1 minute.
Mm-hmm.
Oh. It is stuck. Wait. You know, I cannot move it. So
It's not. It's frozen on the screen for you, Laura.
Let me. Yeah. Okay. Now I get it.
Okay. Cool.
Thank you. Thank you. I'm so sorry for that.
All yours.
So thank you. Thank you so much for this really kind and generous introduction, Perry. And really thank you, all of you. for inviting me to be a part of this important speaker series, focusing on one of the most critical public health issues of our time, dismantling systemic racism. I'm honored to be joining prestigious colleagues in addressing these issues. The Rutgers School of Public Health, under Dean Halkidi's leadership, is truly a leading voice on these issues, as you all know. So during this presentation, I will discuss the unacceptable facts of racism in higher education. Number two, the ASPPH Framework on dismantling racism and structural racism in academic public health, the things that we're doing in the association. And number three, some of the principles to enable institutional change. So let's start with higher education. Higher education institutions are failing to fully buy into an equitable and just society for all. Black and Latino students are more likely to receive education from institutions that are less well-funded, that have higher dropout rates, that operate for profit, that they pay lower faculty salaries, and they have higher student to faculty ratios. The educational spending gap alone gives the students a $5 billion advantage over students of color at public colleges. The advantage, of course, for white students every year. And we all know that spending directly impacts the student graduation rates. For those who do graduate, racial inequities follow them into the job market. A study in 2019 from Georgetown University found that white workers, as compared to Black and Latino workers, are more likely to have good jobs and are paid more at every level of education. The study also found that white workers with good jobs earn $554 billion more annually than they would if good jobs and good jobs earnings were equitably distributed in the workforce. As Dr. Krishni Medbir pointed out in her influential article, Envisioning Higher Education as Anti-Racist, American institutions have already ensured immense generational advantage for whites and disadvantage for people of color. This will continue if we do nothing. The time for all our institutions to become anti-racist is long overdue. Being passive is not an option. The public health community envisions that all of our institutions are anti-racist institutions that participate fully in restoring the dignity, sanity, and empowerment of communities of color through policies and practices that produce and sustain racial equity. The members and staff of ASPPH, which is the Association of Public Health Schools and Programs, representing 137 members, more than 10,000 faculty, and more than 60,000 students, have pledged to accelerate our commitment to address racial injustice by teaching skills to advocate for the essential public health values of compassion, empathy, justice, and equity, by advancing research on the structures that shape health inequities and applying that knowledge into practice. We will work with community partners to model the behaviors and values that we must demand on our national leaders and those who serve in law enforcement. We will continue to support the recruitment and retention of a diverse group of faculty, students, and staff to achieve inclusive excellence. As an academic public health community, we recommit to our deeply held tenets of public health, human rights, social justice, and health equity. ASPPH will never be silent on racial injustices. We will use our platform to advance our mission of improved health for everyone, everywhere. And this is how we are going to do it. I'm going to start talking about how ASPPH has a framework to dismantling racism and structural racism in academic public health. To fulfill our pledge, we first considered the foundations on which we could build, including existing activities of the ASPPH Diversity and Inclusion Advisory Committee, and a statement we released in 2019 committing to zero tolerance of harassment and discrimination in academic public health that you have it on the screen. So we did that in 2019. So the Association of Schools, please help me read it, and our member schools and programs are committed to eliminating harassment and discrimination in academic public health. It is essential to provide all our students, staff, faculty, and community partners with respectful and safe learning and working environments. We oppose acts of harassment and discrimination in all forms, while we simultaneously work towards developing schools and programs that are directed by cultural competence and humility, inclusivity, and diversity. There should be zero tolerance for acts of harassment or discrimination in academic public health. As we aspire to apply this zero tolerance mandate, we envision that the cultures of all of our schools and programs will be free of any forms of harassment and discrimination. So this statement was the work of the ASPPH Zero Tolerance Task Force. And the board reconvened the task force immediately with a charge to focus on racism in academic public health. The task force was chaired by Rutgers' own Perry Halkitis and Linda Alexander, who was at the time with West Virginia University and is now ASPPH Chief Academic Officer. The members included leaders in diversity, equity, inclusion, and justice from among our members and programs of public health. In October 2021, the task force released a framework on dismantling racism and structural racism in academic public health, which incorporates guidance from ASPPH members' collective expertise and training, critical voices from the field, and more recent initiatives in social justice, equity, and inclusion contained in the work of ASPPH. The task force started to get together for an agreement on key definitions, which provided the basis for a series of meetings and consultations with ASPPH members to develop the final framework. The framework serves as a blueprint outlining the major changes needed to rethink and rebuild processes, procedures, and policies to dismantle the conditions that enable and sustain racism in academic public health institutions and empower all faculty, staff, and students to succeed in the 21st century. Our goal for academic public health justice is to prepare a 21st century public health workforce that is equipped to achieve the ultimate vision for public health, the protection and promotion of health of all people across the populations. At ASPPH, we champion social justice, equity, and health for all. We strive to create an equitable and inclusive community that respects everyone, values differences, and stands up against acts of harassment or discrimination in all forms. ASPPH is dedicated to being visible, assertive, and supportive of schools and programs of public health as we seek to dismantle barriers that have prevented or heightened inclusion, diversity, equity, and anti-racism in academic public health. Schools and programs of public health have the power to reinvent themselves as national models and champion academic justice, including, among many other actions, training school and program leaders to better understand the impact of racism on public health, education, and outcomes, to champion anti-racism competencies and curricula, establishing senior staff positions that includes anti-racism alongside current inclusion, diversity, and equity responsibilities, identifying anachronistic promotion and tenure practices that fail to embrace inclusive excellence under the false notion of lowering standards and replacing them with practices that support all on their multiple paths to success and to promotion and tenure. Addressing pay equity gaps affecting faculty and staff, conducting regular engagement and climate surveys, including the state of diversity and inclusion efforts, implementing steps to improve college and campus climate, updating admission policies and hiring practices that ensure diversity of faculty, staff, students, among other activities. ASPPH is also working with CIF, our accreditation agency, and the NBPHE, our credentialing body, to consider how accreditation standards, competencies, and guidelines should reflect the goals of inclusion, diversity, equity, and anti-racism. The framework outlines concrete actions in 3 domains. Number 1, education, pedagogy, and training. Number 2, practice. And number 3, research. With each of these 3 domains, strategies are proposed in relation to 5 key groups and timelines: faculty, staff, students and alumni, population served, and the public health workforce. And in terms of immediate strategies, 1 to 2 years, intermediate strategies, 3 to 4 years, and long-term strategies, more than 5 years. I will provide a brief overview of each domain and some very concrete examples of the recommendations. So domain 1, education, pedagogy, and training. In the education domain, the task force presents a set of pedagogical approaches to guide teaching and transform learning to promote anti-racism in academic public health. These approaches include curricula, competencies, climate assessment, professional development opportunities, mentoring for students, and revised policies to guide application reviews and scholarship opportunities. The framework supports the work of the ASPPH Frame the Future 2030 and scholarship of teaching and learning initiatives with a common goal of collaborating for educational excellence. An immediate recommendation for faculty is to adopt and adapt public health curricula to highlight the core role of racial and other discrimination impacting the health and well-being of communities, populations, and individuals. One way to do this would be to assess all courses content to determine whether and how they address issues of diversity, equity, inclusion, and justice. Some immediate actions that can be taken for staff are to require trainings on relevant issues such as inclusive excellence, holistic application review, and anti-racist admissions and hiring practices. On an intermediate timeline, schools and programs should establish or expand postdoctoral fellowship programs for underrepresented students. These are just some of the examples contained in the framework. In the second domain, which is practice, the task force identified aspects of student practice-based learning opportunities, as well as approaches to engage with members of the community and the populations they serve. The proposed strategies emphasize the importance of collaborating with local, state, tribal, and global partners, and with faculty from other fields of study to find innovative solutions to anti-racism and its impact on health and well-being across all populations. In addition, the task force emphasizes the obligation of academic public health to recognize the value of diverse practice-based scholarship. Universities can also make an effort to support students' faculty trips to visit historical sites to learn the stories of racism and colonialism. One thing we can do immediately is engage students in real-world activism and expose them to working with diverse communities and organizations fighting against systemic racism. Schools and programs can also establish community advisory boards and appoint community-based practitioners as visiting faculty and idea scholars. In the long term, it will be important to revise faculty appointment, promotion, and tenure to demonstrate value placed on inclusion, diversity, equity, and anti-racism service. Under the third domain, research, the task force focused on strengthening and expanding opportunities for faculty research, with an emphasis on supporting more engagement by students, staff, and community members to reduce health inequities and address the impacts of racism and social injustice on public health outcomes. The approaches include increased funding and resources, community-engaged research, mentoring, expanding research paradigms, and improving data systems. A critical step is to ensure that underrepresented populations are involved in all aspects of the research. Students should be trained and participate in community-engaged research, and additional funding needs to be available to support underrepresented students for research. On an intermediate timeline, we must invest in the modernization of public health data systems focusing on how to better collect, analyze, and share data on factors that have contributed to historical bias and health disparities. ASPPH is also using the framework as a foundation to include DEIJ in all of our activities. So for example, in Framing the Future 2030, our major initiative envisioning the future of education in public health, which is called Framing the Future 2030, considers elements of diversity, equity, inclusion, and justice as essential to the future of public health education. The vision places equity at the forefront. All three of the external panels are including DEIJ, and one of them is specifically focused on inclusive excellence through an anti-racism lens. But also initiative, climate change and health framework. In this framework, we want to develop a framework for schools and programs of public health to address issues related to climate change and health, like environmental justice, social justice, and health equity is a cross-cutting domain that will impact the entire framework and also be specifically called out in the principles and the recommendations. ASPPH is also providing resources and support to our members and partners to help implement the strategies of the framework. The framework on dismantling racism will impact our work for years to come. Some of our next steps include raising awareness about the framework, implementing the recommendations and helping our members do so, and developing metrics and evaluation to measure progress. Very important fact, what are the principles that will enable all of us to really make a significant change? Number one, all reforms must be committed to reinstating civil rights, restorative justice, dignity, and respect to the communities that have been the targets of systemic racism. All reforms must be holistic, recognizing that racism is a pervasive system that holds a tight iron first on Black, Indigenous, and people of color communities. These recommendations should not be treated as a menu of options, but rather a cohesive and comprehensive approach. All reforms must be participatory, enabling BIPOC communities to share decision-making. Local communities must influence priorities and offer meaningful oversight. The reforms should be intersectorial, acknowledging the great diversity among BIPOC communities, which when intertwined can deepen the inequalities in our societies. And I just want to end by saying that we, in higher education, and especially in public health, we need to champion this effort. We need to model how it is to live in an anti-racism environment. If not now, when? If not us, who? Thank you. I'm looking forward to a very engaging conversation now. To you, Perry.
Thank you, Dr. Magaña, and thank you for your insights and for calling out the work we've been doing over the last few years. I think that I've said this before in public forums, but ASPPH is in fact one of the leading organizations in this regard, actually taking more than putting out statements, but actually taking actions. And we're thinking very collectively about how we implement these changes at our own school, but also at schools and programs of public health throughout the country. We have an opportunity to do a question and answer with Dr. Magaña, and I want to start to kick us off by asking Laura her thoughts on this. We live in this very polarized environment, obviously, and what goes on here in New York and New Jersey doesn't necessarily what happens in Alabama, Mississippi, and what have you, and other places around the country. What do you think our challenges are going to continue to be as we try to roll out this plan, and how do we work with our various partner schools and programs who are in less favorable situations in places like Rutgers are? What are your thoughts on that?
Yeah, thank you for that question. I think that for many years we have in higher education, we have been emphasizing the need for the cross-cutting competencies that are more like the human competencies. We all need to develop more of the listening skills, collaboration skills, empathy, and all the cross-cutting that are more like the human competencies that all society needs. It's not just the higher education. I think that all those competencies, we need to really emphasize those since the primary, and then of course high school, and then of course the college, because if we all are building our society, we need to realize that not everyone feels and thinks the same way as we do. And sometimes our first reaction is just like, we want to hear this is the right thing to do. But then we need to hear other voices, and diversity is about that. And sometimes we need to really step back and just listen. What are the arguments? Why these other voices think the way they do? We need to be inclusive, and we need to work with them, with all of us together. But we need to develop those skills. It's not easy. It's not easy. It's easiest to be always talking among ourselves, and we love to do that, right? We love to, for example, be in our safe space, which is the public health, because we have always been like that. We have always been so focused on the person, on diversity, on the disadvantaged people. That's what we do. That's why we feel so comfortable. But the world is not like that. We work with other that not necessarily think like us. Just think about even the health professions. Sometimes we stand up, and not even the health professions, we think the same way. When we talk about the social determinants of health, when we talk about health inequities, when we think about, it's not about just health care, but about what are the conditions? And the conditions are always in these other populations that we know very well, but they don't know that well. And they are not open sometimes to just listen to the public health perspective. So I think that as a world, we just need to be part of the communication, with part of the group. We need to listen, really, we need to listen carefully about the arguments and try to start with a common understanding. What's the basic understanding that we can all agree, and then start building from that. So that takes a lot of collaboration in our part, of course, as well as the others, but it would be better if we all grow up and build, those skills before we actually are in a situation where, so we need to learn as an adults, what are these skills that really are going to make us move forward, Daniel.
Thank you for that. Let me follow up with some questions that are appearing here, and for you to think about, which is, I can just tell you that at our school right now, that we've developed, as a result of our faculty efforts, our diversity, equity, and inclusion assessment, where we're looking at all of our syllabi and making sure that they are, as best as possible, inclusive in voice and representation and what have you. But there's also conversations on the table right now about how do we include anti-racism and history of racism in our curriculum. Yeah. And this is a tough, right? Because, it's like you keep adding courses, keep adding courses, and all of a sudden you have an 80 credit degree instead of a 42 credit degree. Any suggestions on how you think we can implement this really important work without overburdening the students with additional coursework that's costly and also time consuming?
Yeah, two things. First of all, I want to recognize the excellent lead and work of your school, because you're the ones that actually, the example that I choose from the framework was an example that came from your school that I want to just recognize, because I think that was an excellent recommendation that now is in the framework for everyone to do it. But I know that you were the ones who proposed that recommendation, and that you are actually doing it, which is the most important thing. So I want to just to recognize that effort that you're doing. Most of the things, it's interesting, most of the things that we can introduce in our curriculum deals with the strategy, the pedagogical strategy, as opposed to the content areas, because most of us I am an educator myself, and we have always been, we have this pressure of, updating the curriculum, and I have to put more data, and I have to put more advocacy, and so we cannot really fulfill all these needs that the reality, the current challenges we have. But what we could do is to change the methodology where we teach in order to include more cross-cutting activities, such as, for example, study cases. So you can be talking about epidemiology or biostatistics or you name it, whatever the course is, but the case study that you're using as a strategy, pedagogical strategy is the one who is dealing with these issues, racial injustices, for example, or any of the, or a history of indigenous or Black or all this content. It shouldn't be content like read this history. It could be just a discussion on the class. You can use a lot of the case studies. You can do simulations. You can do videos in order to just bring the discussions to the, and then apply it to your regular course. You can be teaching health promotion, for example, but with the lenses of racial inequity. So the way we're going to change things is that if we introduce all these topics through a cross-cutting lens that could be done in the references. I mean, not just the content, but the references that you use for your course that could bring from those communities. Case studies, you can bring people to as a guest speakers to your classroom that can actually address that. So just think about creatively about this, the pedagogical, approach to the courses. And I think that we can do a lot to the cross-cutting lenses of the racial, as opposed to just adding more content to the, because at the end, let's face it, even just adding more content, more things to read, not necessarily is going to change the way that we focus this. What we need is a different behavior. What we need is a different thinking about these issues. So the thinking and the behavior comes from discussion. That doesn't come from reading. Maybe you can do the reading. I mean, you can do the reading, of course, but that's going to be like your homework, right? This is the reading for next class. But what happens in the class in terms of the discussions and the points of view, that's the most important thing where you're really going to develop these competencies that you want from your students.
Courtney, do we have any other questions for Dr. Magaña? Because that could go on for hours here.
No, not at this time.
So I'm going to ask my next question, Laura, to you, which is, I'm shouting out to my colleague, Stefan Schwander, who wrote on the side. He was so happy to see the climate change and environmental justice integrated here as well. And can you talk a little bit about that? I mean, I think we have an opportunity to talk about that particular framework and the work we're doing there too, and how you see it complementing the work we're doing with anti-racism.
Yeah, it's interesting, like framing the future, when we think about the education for the 2030, how's that happening, how the higher education like data that we have, if you see that major discussions such as climate change and health, which we all know that if we don't do anything now, it's going to be there's not going to be just a future for us or for our next generations. And we think about dismantling racism, the three topics are so interconnected. I mean, we live in an interconnected world. That's the other thing. These are not topics just for us, for the nation or for the association. These are national and global issues that we better start understanding that we are so connected in so many issues and so many at the world level, that these are going to be the discussions that we're going to be keeping on with the association, but also with other associations around the world. Now, climate change has a lot to do with inequalities, because that's the populations that are the more unequal are the populations that suffer the most in terms of the climate change impacts. And also those populations are the ones who are actually not arriving to higher education. So when we talk about framing the future in terms of educational models and how can education be really an enabler to really development, then we should again talk about inequalities and talk about disparities in everything. So I think that what we're doing is we're just trying to connect the dots. Everything is really so interconnected. So it looks like three different initiatives, but they're not. I mean, they're really very connected. They have very specific issues to attend, of course, but I think that the three of them can be seen as the major, if we really want to move the needle and to make a significant change, these three topics should be interconnected and should be just moving forward. And I can see the role of academic public health doing this. Academic public health can really champion actually the three topics. And let me tell you that, for example, in terms of the climate change, our colleagues, I participate in one network which is FASHOP, which is the other health professionals and so we meet regularly. Well, they have asked me to present to them next month our climate change framework because they want to see what we're doing in order to see if they can endorse that or they can do their own thing. So again, this is public health leading the way, and I'm so happy to say that we are so collaborative that we would love everyone to at least the other health professionals to work collaboratively with us in order to really change the conversation, because at the end, health, it's about the conditions. Health is not about healthcare, it's about the promotion, it's about how do you develop healthy environments that again, that relates to inequalities and that relates to climate. So in a way, everything is related. So the more we're open to work with our colleagues, first in the health professions, which I think is our first responsibility, but we need to go even beyond that because we know that health has to do with having parks that I can walk safely to my work, that we can have like environments. So we need to be thinking and working with architects, and we need to be working with lawyers and economists, and actually more than by the health professionals. But let's start with the family first, and the health professionals we are not in the same page right now. So let's start with that, and then let's move to the professionals beyond health.
We have some questions here, but I want to first of all acknowledge my colleague, Dr. Derek Schindel, who wrote that in the Environmental and Occupational Health and Justice, because our department is called Environmental and Occupational Health and Justice at the school, we've added that recently. We already include a module on environmental and social justice, plus community-based, schools-based research, and a module on climate change, extreme weather events. And it's the last quarter of our course. So I just wanted to acknowledge Dr. Schindel saying that. This is a question from Melissa Cheplick, who said, can you talk about how disability intersects with racism, especially as it pertains to accessibility of resources, for example, climate, environment, emergency, and information in our communities? Can you talk about how disability intersects with racism?
But how you say how visibility? What was the word?
Disability.
Disability. Oh, thank you for that question. Thank you for that question, because so often the whole area of disability is just like forgotten, right? But again, this is another, when we talk about health inequalities, we talk, yes, about disadvantaged populations, and we talk about race, and we talk about ethnicity, but we also talk about disability. I mean, disability has to be part of the whole context, and we need to be, when we talk about how can we be more inclusive and diverse, we cannot forget the special needs that some people had, and I think that our society, that it's a whole it's a whole area that we're not doing a lot in order to really be inclusive to all of them. But I think that if we really are serious in the business of health inequality, health equality, and we really want to bring everyone, including, of course, everyone is everyone. And I think we have it in our mission, like we really want to, to have health for everyone, everywhere. And that's very intentional, those two words, because we mean everyone, meaning all the communities. We don't want to leave anyone behind, of course, including disability. We need to really, again, put some money and funding, and how do we learn better, how to integrate them, and how to have the resources that we need in our work environment, in our educational environment, in order to make sure they are not only reached to start our programs, but we need to ensure that they succeed, because they have the same problem of some of our communities, that we think that we do a lot by really, let's say, like promoting all our programs with disadvantaged populations. And now, finally we have this group, and then they enter our universities, our programs, and then we let them like, okay, like magic, they're gonna succeed. And that's not the case. Historically, we need to really make sure they succeed. And that's the same with disability. We need to put the resources, the mentoring, the monitoring, in order to know that our job is not just attracting them to our programs. We need to make sure they graduated with success with our program. And even beyond, we need to also, hopefully, our schools and programs are looking already into what's next when they are in the seeking for jobs, and really following them in their careers, because our job is to make sure that all our graduates not only are we are inclusive in terms of entering the school, but actually, ensuring that all of them are successful graduates and then successful workers in the workforce. And so thank you for that question. I think disabilities is one of those groups that we need to just pay attention, I think.
And if I could just add to Laura's excellent comments, Melissa, is that I think at the school, we think a lot about the notion of intersectionality and the notion that individuals hold more than one identity, they hold multiple identities. And disability intersects with race, intersects with sexual identity, and sense of gender identity, with all of these, with socioeconomic status, with like a nation of birth, and all of those are defined who the person is. So there's this tendency, I think, when we think about like populations, and this is why I don't like research that is just purely based on demographic factors that focuses on disparities, right? Because it's so easy to say like X population has this behavior, when in fact we know that within every population there is a diversity that is, that is quite wide, right? And so looking at all of those factors together and how a person's life is defined by many of those factors is really critical, and disability is one of those really critical factors. So thank you for asking that important question.
Absolutely, absolutely.
This is a question from Dr. Leslie Cantor, who is our chair of our Urban Global Public Health Department, said, I just lost it. I love that community engaged research is emphasized in the ASPPH report, but research funding is still heavily skewed towards other types of research. Yeah. Is there a role that ASPPH can play with the NIH and others in encouraging more funding for community engaged approaches?
Thank you for that question, because that's still a challenge. We are advocating, and yes, we have a lot of activities in terms of the advocacy that we do in the association that I didn't cover in this presentation, but we're really concerned about that, because the same way I'm saying that when we work with our colleagues in the health professions, we're always emphasizing that it's about promotion, it's about the conditions, it's about the social determinants, it's not just about care. That same conversation we have in CDC, we have in NIH, and we have with the funders, because I think that in general, the society thinks that it's about medicines, it's about the care. So most of the money goes there for basic research. And I think that's slowly, very slowly, changing a little bit. There are some voices right now that internally in this funding, especially NIH, that are thinking that, oh yeah, that's true. I mean, it's very important to really also invest in research that goes beyond the basic, beyond medicine, beyond the clinical side. It's more related to the social conditions, more related to public health. But there's just a starting, so we need to keep on raising our voice, and we are doing it, very loudly in terms of NIH and others, in order to keep our voice there. And we will do it, and we will continue to do it until the situation changes. But there's a lot of work to do in that area as well. I think, in a way, the pandemic has kind of softened some minds and some hearts. They know a little bit, some of them, that, oh, we better do something, in the area of public health. So I think a little bit is changing, that scenario. I hope that for the best in the future, but we just need to keep on advocating for that.
Laura, you've heard me say many, many times that I'm tired of the biomedicalization of public health, right? And that, and I think you're 100% right to say that the pandemic, there's always silver linings in all these bad things that happen in our world, right? But the pandemic showed very clearly, sure, you can develop a vaccine really quickly, but and you don't think about human behavior and human emotions and human social circumstances, that vaccine's not going to do nothing, right? That's like that's bad grammar. That vaccine's not going to do anything. So we have to have that kind of research to talk about that. And my colleague, Kristen Krause, and I don't know if Rafael Perez Figueroa is on here right now, is, they're working on a grant, an R01 right now, to talk about how we're going to deal with messaging for an HIV vaccine when it becomes available, right? Because we fear what will happen is that people who need it won't access it. And it's a big public health research question, and how we do it.
No, absolutely. So yeah. So thank you for that question, because we should continue advocating for that perspective in public health. Yeah.
I have a question from, I believe, Stefan Schwander, who's one of our professors in our school. And he writes, racism is directly connected with colonialism in the past and exploitive economic principles at work today globally. How do you envision these aspects to be integrated into education, especially these are controversial, ideological, hot potatoes? Thank you, Stefan.
Thank you for the question. And those are the hard questions. I think that at least we're now talking about it. I mean, if you think about it, years ago, we didn't even have this kind of conversation. So I think that having the conversations is just, starting to open the door. It will take a lot. It will take years, to really move the needle in all of these issues. I get that. But I think that we should lead the conversations. We should lead the changes. We should be championing example, institutions in order to really do a change. I think that if we get impatient, and I think that if we say, you know what, we have been doing this for 2 or 3 years, nothing has happened, nothing has changed. The changes in the institutions, they are the same. So I think that it's hard. It's very hard. And we need to really, put together everyone. And I think that the first ones to be thinking about all these changes are the leaders of our organization, in order to start really making the changes in the curriculum, in the classroom. And we're going to have there's a lot of voices here and a lot of controversy. It's not easy, but I think that it's just about keeping on doing it, talking about it very openly, frankly, raising our voices. And I would say, like, in all parts of society, not just the classroom, not just the family, not just the street, it's just in everywhere. If we keep on doing this, I'm very hope that, the young generations, or even the kids, when we start kind of re-educating, the way we do our kids, and then also, the adolescents, I think that they are the ones who are actually going to see the real change, because we're trying, and we're trying hard. But I think that we just need to keep on doing it until we start doing the change, and trying to, to have more collaboration from others, because the more we are, the better we possess ourselves in order to find like funds and organizational changes and everything. But I think in higher education, we should do it. And there is a lot of voices already trying to do this. So we would come together as a community of, people who really think that really a change is needed. I think we'll do it.
I think you're exactly right. I want to also just say that I wanted to acknowledge Dr. Pasanante, who is our Associate Dean for Educational Program Development, who pointed out to the fact that, when we're talking about disability, the issue of disability, that in fact we are trying very, very diligently to enhance our Canvas, our online platform, so that it can be much more accessible than it is right now. A recognition, I know Michelle is working right now on updating our website, which also will be ADA compliant. So these issues are really like these things that, that we take for granted, we should not be taking for granted, that all of these materials have to be highly accessible and what have you. So I wanted to just acknowledge that also. So Dr. Magaña, politics and public health. This is going to be my last question. I'm going to ask questions like this all the time, because it's Perry, right? Politics and public health. What role, how do we as public health leaders, and as the future public health leaders, I see several of our students on here too, ensure, how do we continue to do work that shifts the minds and hearts of politicians to a world that is more inclusive, more focused on health equity, less discriminatory, and then embodies policies that everybody has an equal chance? What can we do? Because sometimes it feels like really, 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 really frustrating. We're dealing with anachronistic policies at our own universities, including my own, and we're dealing with anachronistic policies on the federal and state governments. What do we do besides screaming and yelling and acting up? Any other thoughts on that?
Yeah, that's, again, we all have, in public health, we have only hard questions, right? So first of all, I think that it's very important to be engaged. Yeah, because I have heard voices there, we're academic public health, we just do our business and forget about politics. No, I mean, we have to be engaged. So number one lesson for me is just like we always need to be engaged on politics and public health, because if we really need to change the system, we need to be in the system, not to change it. You cannot change it from outside, right? So be engaged, number one. Number two, I can see like several venues. One is that, of course, through our students. I think the more we educate our students in advocacy and in politics, the better. So if we can partner with, for example, for the political science school or programs in our own campuses, I think that's one way to really educate more our students in how to be effective advocates and effective politicians, effective, person that can affect politicians. So I think that's one way is engaging our students in that, engaging our students in activism activities, for sure. I think that we need to keep on doing that, and your school, you and your school are great voice in that. I mean, the way you raise, for example, social media, your voice and your issues is just incredible, powerful, and that really, a lot of people is stimulated because of that. So we need to keep on doing that. We think that nobody's listening. No, yes, a lot of people is listening, and you are modeling what everybody has to be doing. So I think that just keeping on doing that. Now, eventually, I think that just trying to engage with our local, at least start with that, with our local politicians, and of course the national ones, in terms of just trying to be more engaged in what they are doing and raising our voices. I think that's very important. And then nationally speaking, keeping what we're doing as a national association. Of course, we advocate and we do have relationship with the White House and with the legislation, and so we do have the national advocacy agenda that we are there all the time trying to really make a change there. But I think that grassroots is very, very important, just working with the community, because politicians, they care because the votes, right? So if we're there with them and trying to these are the issues that the communities are facing, and trying to help them at least raise that that need, something that could resonate with them. I think that's something that we need to also learn as public health communities. Sometimes we are so focused in what we think is right? Of course, the health and the well-being of the people, and see what happened during pandemic in the first 6 months, that our messages from public health were about public health, right? It's like, you have to be vaccinated, you have to mask, because you need to. Actually, we even started with a different message that didn't went well, because we said, in order to take care of others, you need to mask, right? In order to take, so people, that resonates with us, right? But people is like, who cares? I just want to go to the party, I just want to go to the restaurant, right?
Right.
So when we did a survey about why people were not following the guidelines, we find out that it was because they didn't get it. I mean, the health and well-being messages were not just they didn't get it. So when we start to change that message to, if you want to go out to work or to the restaurant, then you have to mask. When they start the important message for them was the economic and the social impact, not the health issue. So when we heard that, and we do the messages because what they were care about and what they wanted to hear, in order to, we're talking about changing behavior. We need to hear what changed behavior on the people, not what we think is the appropriate thing to do. So I think it's very important for us to also hear what the politicians need to do, and try to just change our message in order to gain them, in order to do the right thing, but maybe just, changing the language that way. And let me just touch on maybe one more thing that I was thinking right now is that another thing that we do very well is just we write papers, right? We do great research, generate the evidence, and then we are trying to do our papers, and we need to keep on doing that, of course. But something that we don't do well is just to translate our findings to the politicians, to the community.
Right.
And we need to reward that work. When we talk about tenure, promotion tenure, is that how well we recognize, because we recognize that work that is key, fundamental to the development of our community and our politicians. We need to really recognize that that doing more policy briefs or more communication to the community, that's as important as the paper that just was published last month in Lancet or whatever, right? So I think that those are the things that are the great opportunities to keep on developing these areas.
Yeah. Yeah. I mean, it's what we say at the school, which is keeping the public in public health, right? Keeping the people in public health, remembering that, that people, that we are dealing with human beings. I do have another question actually from Dr. Shandell, who said, do you think that the ASPPH member programs in schools located outside the US will embrace the types of processes of change as much as, less than, or more than the US school, public and private schools and programs? For example, the Mexican program that's part of our organization, the Taiwanese program. What do you think? Are they going to be more? Yes.
Thank you for that, because I'm one of the supporters of, as well as Perry, of the global approach to things. We cannot think that our problems is our problems here at national. No, nothing. I mean, the pandemic was a great example for the people that were, less concerned about the global impact and the interconnectivity of the world. All these issues, the racial issue, the inequalities exist all over the world. I come from Mexico, as you know, and I'm very, familiar with all Latin America, which is actually the area of the world with the biggest disparities in the world. So, of course, Latin America has huge, tremendous challenges in terms of health inequalities, but the same is true in Europe, the same is true in Africa, the same is true. So I think there are some things, some common topics that it's about everyone. It has, of course, specificity, right here, maybe it's more the racial, in Latin America is more the social inequality, and in another part of the world, more like the ethnic part. But regardless, we are the challenge of inequalities around the world. I think it's human behavior, and we need to deal with that. It's privilege about the ones that have and the ones that have not, right? And that, you name it, it's racial, ethnical, or any other of issues. So I do believe it's a global problem, a global challenge that has to be faced globally. And we in the association has a global network now where 7 associations, the same as us, we have the association from Africa, from Latin America, from Europe, from Asia. So we are together as a network, and we have calls frequently in order to see what is the issue right now global that we can all beneficiate if we as a network of associations can talk about it, can do something about it. So the more we know about that and the approaches that maybe another association, another country is taking, can teach us more than what we're doing, right? So I think that we should be open to work globally. Very, very important.
Thank you for that answer. And, and thank you for this session. I want to just encourage, I just want to tell, for those of you who are not aware, our school is very, very actively involved with ASPPH in leadership in all of the sections with our representatives. Please take advantage and interact with ASPPH. There are opportunities every year at a national conference that's held in Washington, in Crystal City and Washington, D.C. to present your work. There are awards to be had. There are opportunities for students. So please, we are a member organization, and this is a great organization if you are dedicated to public health education. And as you can see, led by a remarkable, charismatic, super smart leader in Dr. Magaña. And I want to thank you, Dr. Magaña, for taking the time to be with us today. And I appreciate every minute and everything you do for our field. Thank you all for being here.
Thank you.
We will see you again very soon.
Thank you so much. It was a great honor to be here. Thank you, Barry, for everything you do.
Laura. Thank you, Laura.
Association.
My honor.
Thank you.
Bye, everyone. Have a good afternoon. Be safe. Stay warm.
Thank you all.